Assalamu alaikum. I am Dr. Muhammad Ali Rabbani, Assistant Professor Anatomy, and today I will be your guide for the topic of gross anatomy of larynx. This is a lecture in the series of the crash course in which we have been discussing the gross anatomy of head and neck. This is basically the part 2 of the lecture that we started. The previous one, it was nose, paranasal sinuses and larynx. So we ended the previous video at nose and paranasal sinuses, and now this video we will start with the topic of larynx. We will study all of its structure. We will start with its overall skeletal structure, and then we will go on to the membranes, the structure, the folds, and the muscles, and then we will end with the lesions. Larynx. Larynx is basically the respiratory organ that is present between the trachea and the pharynx. We have yet to discuss the gross anatomy of the pharynx. So, in this is a very beautiful picture from the Gray's Anatomy. Here, this is the oral cavity. On the top of it, in the blue, it is shown the nasal cavity. On the back in the green, there is the pharyngeal cavity. The one that is behind the nose, that is nasopharynx. The behind the oral cavity is the oropharynx, and behind the larynx is the laryngopharynx. And in front of it, the outpouching, the branching occurs in front of it. This is the larynx. This is the opening that is opening back into the oropharynx, that is opening back into the laryngopharynx, and behind there is the major larynx, and it continues down into the trachea and onto the lungs and onto the lower respiratory tract. It is present behind the hyoid bone. The hyoid bone, when this is not a exactly anatomical position, horizontal picture, it's a picture a little from above. When you're looking horizontally, the hyoid bone it's roughly at the level of C3. That is the level of the epiglottis also. Because we are looking from the above, we are not seeing them as the horizontal plane. Below, this is the cricoid cartilage that is lower, and that is at the level of C6. The thyroid cartilage, this is at the level of C4. So usually we talk about the larynx as lying between the C4 and C6. We are usually talking about the upper end of the thyroid cartilage to the lower end of the cricoid cartilage, and if we include the upper end of the epiglottis, we will be going up to the C3. The larynx, the major function of the larynx is the phonation. I'm talking to you right now, I'm recording this video. The sound that is coming is from the larynx. The second very important function is to function as the gateway of the airway, at least gateway of the airway as it becomes isolated. From the top you can see there is a part of the airway that is the nasal cavity, and the pharynx was a shared space that was shared between the digestive system and the respiratory system, and then it is larynx is the pathway, the gateway for the lower respiratory tract to be more clear, and it is the sphincter for air passages. It protects the airway from the food and water and drink that is going through the pharynx if it diverts to the larynx.